Hi everybody, my name is Craig. I work for the Roselle Fire Department. Today we're going to look at our ambulance. This is our brand new ambulance. It's a 2019 Ford. We got a lot of stuff on the outside of it, but we're going to focus on the inside here. Of the 2,700 calls we run at this department, about 80% of them are ambulance calls. Very few fires anymore, but ones we get are pretty good. But we'll take a look at the meat and potatoes of what we do here at the fire department. One of the first things you'll see when you open up the back here is our cot. This is where the patient goes when we go to a call. We have a special little device here that lifts up our cot for us, and we just slide it on out. And this holds all the weight of that patient, so it saves us from having to lift people. Then we hit a button on this cot, it lowers it down for us. When we press another button, it releases it, and we can pull it straight out. And that's the opposite, but the same to go inside. So you take it out, we go into your house, treat you, put you on the cot, and we bring you back into the ambulance so we can take you to the hospital. Bring it back in. Once my lights are green, it's ready to go. Hit another button. Thumbs up. Slides on back in. These two things together, the cot and the load system, are going to run pretty expensive. They are probably a little more expensive than a really nice sports car. So we have some very nice equipment here. We're going to take a step inside, show you around. Turn the lights on. So you'll see when the cot is in the ambulance, it is front and center. It is the center of all things so that we can get as many hands on deck as possible to help whoever happens to be laying in the bed. You'll see that we have a hop system here for each riding position in the vehicle. This is a 5-point restraint so that we are very safe back there in the event of a crash. The patient is in a 7-point restraint. So we have shoulders, we have 2 straps across the chest, or 1 strap across the chest, 1 strap across the lap, 1 strap across the legs, and 1 strap across the ankles. So the patient is very secure throughout this whole transport. Basically, everybody that works on this ambulance is a paramedic. We have the ability to do anything that they can do in the emergency room right here, which will be in your front yard if that's where we get called. Up here in this upper compartment, we have all of our IV supplies. So we can start an IV in order to give medications or fluids. Moving on next to it, that's where all our fluids are. So we have IV bags, we have all the tubing that goes with it, we have syringes, we have needles, we have the whole deal. Moving around to the front here, we have this device here called Lucas. Lucas is just a brand name. There are many variations of this product out there, but this is called a compression device. So when we're doing CPR on somebody that doesn't have a pulse, we don't have to physically do the compressions anymore. We can bring this out. It comes with a plate that goes underneath the patient, and then the Lucas clicks into that plate on top. And it is a piston that presses on that patient's chest for us. So it frees up, typically we would have 2 people doing compressions. It frees up 2 people to do other more important things. Lucas is our friend. This is pretty standard for any ambulance. Our purple bag is for pediatric patients or kids. Those have all of our pieces of equipment that are specific sized, smaller for kids. We just have a drawer full of miscellaneous things, medications. We are governed by standing medical orders, or SMOs. We work for the Region 8 system. We're CDH paramedics. So this book has pretty much anything that you could do as far as a medical emergency goes. And it tells us how we're supposed to do it. These are our guidelines. So sometimes less frequent calls when we're not exactly sure on a medication dosage or whatever, we'll open this just to cross-reference and make sure we're giving that person the best care possible. Down here we have these, they're called our jump bags. They're just our quick access bags. The top one is our main jump bag that has a lot of different things in it. It has our trauma supplies for injuries. That also has the same IV equipment that we had in that upper cabinet, as well as many other things, medications, splints, all kinds of stuff. The one below that is our oxygen bag. So that has all the stuff we would need to initially just give oxygen to the patient if they need it, and all the different ways that we can give that. And we'll move up here. Typically the person that's in charge on the ambulance will sit in this seat during the call, and they will call the shots and tell everybody else what to do. Up here, since this is closest to the patient's head when they're laying on the cot, these are all of our airway supplies. So we have both pediatric and adult oxygen delivery devices and all kinds of different things that we would need. But that's typically where you'll find that in most ambulances, by the patient's head. Nice and convenient. Moving on here, we have our heart monitor. Just like everything in the medical field, this is also very expensive. One of these runs probably around $30,000, and we have 5 of them. It gets expensive quick. But it is a magical little device because we can, like I said, we can do anything that they can do in the ER. We can hook this up to the person. We can take their blood pressure. We can check their oxygen saturation level. We can look at their heart. We can take a full-on 12 lead EKG right from here. So that's pretty nice. Very nice equipment. All departments have these that have ALS vehicles, but the brand will differ depending on where you're at. Moving along here, we have, the label says an OB kit. That's to help us deliver babies. We have delivered babies. I don't think one's been delivered in this ambulance yet. Typically when we deliver a baby, our chief will buy a stork sticker and put it on the ambulance, whether pink or blue, and then put the date that the baby was delivered. So they don't happen that often. Then we move on here. These are all of our trauma supplies. So we have trauma sheets and burn sheets. Those are just big bulky dressings for in case somebody gets burned or has a really significant trauma. Basically anything we would need to patch somebody up or stabilize an injury, you can find in there. That's about it for in here. And we have a lot of equipment and we can do a lot of different things. We're pretty much prepared for anything that can be thrown at us.